May 11th. Wow, it's so we're gonna look back and look ahead at the same time today. That's what we're gonna do together. Okay, that was, from my perspective, a really good way to go. So let's just look at our journey. First, let's do the typical statistics thing, which maybe I'll stop after this week, but let's just play the statistics game. I did something different this week. I compared 2 weeks of the virus for our state, and then you're going to see another thing about the DDS residential community. And basically comparing this past week, but I had to pick Friday to have the right dates. The data I was getting was off by a day, so I had to pick 2 days ago, collection of data. And what we found out that we had a rise, we still continue to grow in the number of people that are being tested in Massachusetts. And there was 1,900, almost 2,000 more people tested this past week than the week before. And that means there was almost 76,000 people tested. The total number of cases, of positive cases, however, rose less. It still rose by 11,000 people, but that's 2,320 less than what happened comparing the previous week with the week before. So that means the cases appear to be rising slow. Remember, we're not hitting all the population, so there's no way to be sure. And then the number of people who passed away, unfortunately, and died, it grew fewer than the week before as well. It still took 986 lives, but previous week period, it was actually 174 more people had died. So that's a better sign. We'd like to see it, obviously stop growing, at all. But we're hoping that this is a good trend. And I did check it. I did get another thing on Sunday statistically, and the statistics, I just checked it just to see that we were still holding, and we are. So in our state, by May 8th, 366,000 people were tested, and the total positive was 75,333. And I have to drag this thing down a little so I can see. On the Globe, there's a note from the Globe in terms of those numbers. It's still concerning, and we're hoping it's going down further, and to the point where it won't grow much at all in the future, we hope. Thanks to Representative Josh Cutler. He posted over the weekend again some statistics in the DDS residential network. Keep in mind, this is not everybody, and you'll be getting a PDF of this document in the email. Remember, Kerry sends them out. So if you take a look at this data, he put it out. It's from 5/7, so May 7th, and it doesn't include people living with family, people living semi-independently. It's people that are formally in the DDS residential services. So what we have, again, now some of this staff testing and residential testing of people living in residences, there's some duplicates here, because if people are test positive, they may go back to a home in a few days. But as you can see, as a percentage of the population, we continue to get tested at a higher percentage than the general public. And that's a good thing. That's mobile testing. That means when a vehicle comes to the house, or pop-up sites. So different providers or different places put up a tent. You're able to come in with your car. It's a pop-up site. That's why there's more staff tested. Staff will drive to a pop-up site. And of course, there's more staff working than residents. So that's just a reality too. The residents' cases went up a few hundred from the last time we shared this. It's 1,243 people. The staff cases are up to 1,386. I don't have a formal number on staff deaths. I know the last time I heard it was relatively small because of the ages of people and whatever. The residential deaths, people with disabilities living, whether in homes or different statewide, across the state, regardless of the setting, is 57. And it was 34 about a week ago. So that gives you a sense, and hopefully it will be very small, the number of deaths. We just have to pray that having people in smaller homes. I also have been hearing from people that have loved ones in shared living or adult family care, foster care. And obviously those are even smaller settings, right? And that's something for the future to think about, having more smaller, even smaller settings than we do today. Because then, the virus doesn't pass as quickly, obviously. But clearly in the smaller homes, the virus does not pass the same way it does in large settings.
So, hi, Leo, Carrie here. A couple questions have popped up. Do we know how many, Alex wants to know how many DDS clients are hospitalized?
I don't have that number at the moment. I know it varies because people do come home, thank God. People go in the hospital. In fact, people have gotten ventilators. There's been no holding back on any of that because the surge did not happen because of the orders that Governor Baker made to have people stay in place to the largest extent possible. But I don't have that number. And I would think if you look at the positives, if you go back, that there's 1,243 positives with 57 deaths. I would think at some point there's been, across the state.
Sigue tú entonces. Te dije que iba a estar un...
Someone in the background, could you mute? We can hear you?
Just did.
Okay. So I wish I had a firm answer for you, Alex. I'm sorry. Yeah.
Okay, a few more.
Chris,
on this issue, do staff and residents testing positive numbers, do they include people's through their person's primary care physician? Christine was wondering.
What do you mean? Like, how do they find out, or what's...
I would think it's about, these numbers are generated from the actual department and not where they got tested.
Correct. So let me explain. I'll explain that. Okay, now I understand the question. What happens is every provider, state or private, all right, and most are private providers, but they have to report every day, okay? And if you may recall, those of you on the last week, I was surprised how many homes there were, okay? And so that means with 183 providers and state homes and all of that, when you think about it, all that data is going up centrally to DDS and the Executive Office of Health and Human Services. So that data gets collected, but it comes from the home. So when a test happens, as soon as an agency knows, so let's say usually it's in the pop-up test or it's through the mobile home. If it's the mobile home and they get a phone call, the agency's informed about the test results for the people they serve. But for the staff have to report to them in some cases. They're at the pop-up test, they get notified, okay? If they're at a pop-up site, they then inform the agency. So their report may be 2 days late, a day late. It all depends when the report gets back. Some agencies have waited 4 days to get the reports back. As a rule, it usually is not longer than that, though there's been exceptions. So then that data filters up to DDS, it's collected, but that's where the data's, can be different than the data that's being collected from hospitals. There can be some slight mistakes. So we think it's, pretty accurate, but it's going to be a little different because of so many places the information's coming from.
Okay, we have several other questions on this topic. Do you want to, move on and we'll get back to them then? Okay.
Let's do them. What do you think, Carrie? I'll go with your recommendation.
Yeah, well, let's take a few more. And so Beth was wondering how many residents who died were hospitalized. Do we know that number? I
don't know that number, but I do know, I hear anecdotally from colleagues about this. And, I sometimes get the backstory as well, of how someone looked great and then suddenly had to, fall back. But I don't have, I think as a rule, they would be in the hospital if they passed away. Though I'm sure in some cases, they haven't gone to the hospital because suddenly the fever spikes and things go south and people are surprised. We've heard about that in the general population as well, where suddenly in the middle of this thing, everything looks stable. The nurse is saying, keep him in place, give him plenty of fluids, help him or her come out of this. But as a rule, I would think it happens in the hospital based on what I've anecdotally heard.
Okay, thank you. And Elizabeth
By the
was
way,
just
people
clarifying.
are being permitted to bring surrogates with them to the hospital, so caregivers, and early on, that was a problem where people were being prevented. But we also have Disability Law Center willing, if someone is told they can't have someone with them, we have them willing to intervene in a case if that happens. So I just want to give you a heads up on that as well. But it's that piece of it's going better than it was.
Okay, good. And Elizabeth's just clarifying that these docs are for all group home providers, correct? State
Not
run
just
and
all group
private.
homes, state too, state run as well. So
Okay.
across the state and the residential, yeah.
Yep. And
10,000
one more.
total.
Do we?
10,000 total people served in that ballpark. Go ahead, Carrie. Sorry.
Okay. All right. And I wants to know if we know how this translates into percentages of residents found positive or staff found positive.
Right. Well, I mean, the percentage, found positive looks higher than the general public, but we're getting tested a lot more. So keep that in mind. Our testings at the last time I checked, last week, I compared our testing to the general public, and we were 6 times the testing numbers. So even with duplication, we're 4 times. Let's assume there's huge duplication. We're 4 times the testing numbers. In terms of who's got the virus, it's pretty small. Who passed away, it's pretty small. Still 57 people though, so obviously it's concerning when but it's 57 out of 10,000 people.
Okay. All righty. So we've got a few more questions, but and Glenn will definitely get to yours and the others who chatted in. But why don't you go ahead, Leo, and
so
move on to your presentation.
The goal of today is looking back and looking ahead. And what really struck me on the weekend, might have even been Friday, I was preparing something and I said, oh my God, it's only been since March 10th or 11th. And in fact, officially March 11th, that Governor Baker made an emergency order. And that's 8 weeks ago. It's not even, 3 months ago. It's not 5 months ago. It's not 6. It feels like it's been months. I don't know about you. I know I feel like it's been months and months. And we've been advocating for what felt like months, but in fact, it's been weeks. And to me, that meant, why not look back a little bit? What happened early on in March? And pretty much all the things I list here happened in March. The state developed a command center. Mary Lou Sutters was appointed lead of the command center. They prohibited large group gatherings. Do you remember at first it had to be less than 50? Then it became less than 10, and it kept evolving right after that to the point when schools were closed, day programs were closed, and non-essential businesses were closed in that order, if you recall. During that period too, I want to point out, because it was so fast moving, the decisions, only a week before March 11th, we had a large gathering at the State House. And we had our joint legislative session with the Mass DD Council. So imagine that. We had over 400 people gathered together, and the virus was live. At that point, we didn't know how live it was. So only a week separated the order from our own large gathering, let alone what other people were doing. Think about it in the state. The virus was probably moving through our state in February, and then we had no idea how it was moving through because people were asymptomatic. That meant staff were going into homes, day programs, residents were going into homes, day programs that a parent may have given them the virus. We don't know. It pretty much was something that was happening. And then in 8 weeks, we saw a variety of things. In the first 4 weeks, there also were some decisions made about funding and additional funding that the state acted quickly on. These are new pictures, obviously showing the early piece. I don't even know if this is probably from New York, to be honest with you. I don't think it's a Massachusetts pic. There's the empty ducks public garden, just the duck with the mask on. So in the first 4 weeks, a bunch of stuff happened in terms of stabilizing the safety net, ensuring capacity in the safety net. And what I mean by safety net, there's 2 levels to it. There's what you might think of the Department of Developmental Services, the residential, day, family support related programs. But then I think of the extended safety net, which includes the mass health services that are so important to so many of our constituents, healthcare, obviously, and all of that stuff, but then personal care attendant services, AFC, BCBA, all kinds, a whole range of services that are so important, home health, nursing, which isn't on the list, should be. And what happened is residential services got two big bumps to make sure they could continue the work they were doing. The first bump happened within 4 weeks, within 3 weeks. The second one happened within 8 weeks. The day programs were committed to. That not all of that has happened yet, which is concerning. Family support services were made more liberal so people could get more stipends and support. Food security was a concern. We're advocating to have even more extended family support services for people. Now that it's been 8 weeks, having youth and adults at home 24/7 that, some of them have challenging behaviors and concerns. The state early on, within the first 3 weeks, increased personal care attendant services, allowed people who already were eligible for PCA to expand their hours since there was no more school or day program. And then they also offered home health as a backup if you couldn't recruit personal care attendant. And for people that were new to mass health, they did fast track for eligibility. And they also did fast track for new PCA providers. And and I heard of a couple of instances where people got approved within 24 hours to be a PCA provider. So, trying to do things that made sense. On the federal level, as we look back, and there's an empty Faneuil Hall, Quincy. Oh man, it's shocking to see it, huh? 4 stimulus packages happened at the federal level. Individual payments based on income that we reported on. There was unemployment additional dollars for people. There was small business and nonprofit forgivable loans that kicked in. And then unemployment assistance for those that couldn't get the forgivable loans. There was unemployment assistance to help defray the cost to both agencies and businesses. And then there was a 6% increase of what the federal government paid for our home and community-based services. That's 6%. And right now we have a bill that's asking for 15% more because states are going to have a huge deficits. And we don't want to see our network of services crushed, because of what this crisis has cost us. And then we go another step ahead. Sorry about that. What are unmet needs? Well, there's probably more than these, but the ones we're focused on right now are families and individuals' situations at home where the 24/7 has gotten to the point where more help is needed. And there was probably more help needed 5 weeks ago. But, people kept saying, okay, it's tomorrow. It's going to get better tomorrow. It's going to, but now we know schools aren't opening anytime soon. People that brought kids home from residential or out of district day schools. And then how about adults that were in day programs that maybe even had extra assistance because of complex medical or behavioral conditions? I'm worried about both those families and those individuals, And just anecdotally, a colleague who has a physical disability was able to get his spouse hired by a home health agency. So because she was legally related, she can't give PCA support, but she was able to be hired by a home health agency. Well, that's pretty complicated to make that happen. It's the rare person that can figure that workaround. But there are people in tough situations who can't work, even if they were able to work. And we really need to think about the families and individuals that are out there that this 24/7 is complicated, making their lives almost to the point of breaking point. And then financial support is a big issue for the day and employment programs and adult family or foster care. We're still waiting, even though it was committed. There seem to be some regulatory barriers for the day and employment programs. We want them to be ready to open with a social distancing model. That's going to be really important. And AFC to me is like one of those important foundational programs for people who are at home with either a family caregiver or a non-family caregiver, and not having extra support at this time seems odd to me. The cost of PPE and other kinds of costs. Special education, we're reviewing now a new guidance from Department of Education and secondary education, elementary and secondary education, and with our partners, and we'll have that meeting later this afternoon. Obviously, for a subpopulation, the virtual stuff doesn't work, and it's sort of connected to families and individuals needing further support. Similar theme there. And healthcare equity, I think because we didn't hit the surge and we had time working together in a couple of different collaborations, I think the medical community and hospitals were more sensitized to our worries about the health disparities. And I think there's been some progress there. We still have more to go. But I just think, these workers are doing such a great job out there on the front lines. And we wanted to make sure in that work, under crisis conditions, they would be sensitized to our community. And obviously there's other communities too that have disparities in healthcare. And finally, this is on the federal goal and unmet need. We have the hashtag We're Essential campaign. We want to see caregiver support expanded, and we want to see a 15% bump in the, besides the 6% that was given, another 15%. Because, for example, in residential settings, the state just made a commitment for 15% more for a couple of months. But there's other costs that have increased that we're not going to have tax money for. So it's really important to have the federal government as a partner. And obviously, we need more PPE to be coordinated by the federal government. We have to get to the point where if you're at home, whether you're an individual or a family or you're an AFC, that you feel confident someone can come in your home and give you the assistance you need. The programs, the residential programs, also aren't fully up to speed with PPE, but they're in better shape because they've been buying it privately. That's been part of their additional costs. They've literally been come from different countries even, just to have enough gloves. Gowns was the biggest problem for a long time. So,
hi, Leo, Carrie here. I thought maybe we could quickly address, there's a few questions about education, Department of Early and Secondary Education. Nancy just wanted clarification that there's new guidance from DESE. And another one was they had heard a rumor that all extended year programs were canceled. And there was, okay, and another one about the school. Has there been conversations about extending school services students who are turning 22 during this time, since day programs are closed?
Yeah, great questions. And so actually that should be on the list. So we got the advisory to review and meet with tomorrow is very specific. It's on annual review team meetings. It's on evaluations, reevaluations, and transition of people from early intervention to school system. Okay, and so those are the things that, we will talk together today and have a joint understanding. So I don't even want to say, I would say the guidance was a great step in the right direction, but they don't answer the questions, some of those core questions, especially there's nothing about the extended year yet. Okay, as far as we know, that doesn't mean certain school systems haven't said something. There's over 300 cities and towns. A private school might have said something. I think we should hold. How can I put this? Not react to announcements because there is no guidance yet from DESE on those two areas, turning 22, nor the extended session. I'm sure we'll have it on our list to talk soon, and I'm sure there'll be some conversation about it tomorrow, but that was not in the guidance. So this guidance is related, again, to evaluations, reevaluations, early intervention, transition, and eligibility, and team meetings to review the IEPs, individualized educational plans. And I know
all right, thank you.
The guidance will be formalized after the meetings with different groups. So just to be clear, so there's nothing to say about it because it may change over the next day or two. They want to get it out soon on those topics.
Okay.
Yep.
All righty, and then just lots of questions about reopening and
so
any idea
reopening
when?
for a second. It's really important, and we should put a memo out on this. Until the governor is clear, just across the state, think about this for a minute. whether you're in a school or you're in a day program, right? Or until the governor, that group, makes its recommendation that's talking about reopening, I think we have to appreciate that other systems, whether they're schools or providers or businesses, they can't really, with any clarity, say what it's going to be like. Okay. So you really have to wait for the governor. Okay. And someone just texted me to reinforce that. Thank you for the text, Kathleen. So it's really important to appreciate that. We're our own state. We're not Rhode Island. We're not New Hampshire. Now, having said that, obviously, if you have someone in an out-of-state school, that may be influenced by what that governor says, right? Not maybe, that's going to be a factor. So that's important to keep in mind. What, another question, Carrie? Sorry. Hello?
Yep, sorry, I had to unmute myself. Lots of issues. There seems to be some sort of resource for day hab providers that you can look in to see what kind of things are going on. And I'm just wondering if you're familiar with that.
Okay,
Judith,
I
Judith
want to
talked about the updates. Yeah.
So in terms of so I mean, if you have, we encourage this early on, and I apologize for not repeating it every week. If you had a day provider, or whatever kind, so agencies are trying to put stuff on their website. Agencies are communicating. Everyone's a little different. Small agencies, big agencies. So for example, on LifeLink's website, which is LifeLink's class up in Andover, or like whatever, you can be anywhere. I don't know how open these classes are, but they actually have the classes on their website, and different chapters of the ARC and agency providers across the state, not just chapters, including other organizations such as New Path or Bridgewell. They all have different models of education or training they're doing. And these are opportunities to take advantage of, and some are open wider. Like sometimes I see things out there that anyone can sign up. So never hesitate, even if you or your family member is not a member of that organization, just, hey, could I come on that virtual experience? And then once in a while, we do that too. That's not the main thing. We do have actually Google Docs that our team at Widening the Circle and Path Friendships has developed, that if you go to the COVID-19 site that we have, the ArcaMass COVID-19, arcamass.org, COVID-19, you can zoom into that Google Docs product and see ways that they're focused on social skills, community options that are socially distanced, but they build on your social skills and all thinking ahead for the day when people could go back to connecting, because we want to bring people together, especially in these isolating times. So there's different opportunities for people. So please don't be shy about it. And you can always email us for reference to a few places, right, Carrie? We're happy to, we can, encourage you to take a look and at those sites. I mentioned a few right off the top of my head. LifeLink's class, and I mentioned Bridgewell. I don't know to what extent Charles River Center or other groups have it open to the public, but different organizations, are basically offering these opportunities. So can I do a little bit of what have we learned, and then we can do the questions and answers some more, Carrie, or is that okay?
Sure.
Yeah, so let's look back. And I thought this session might go to 12:40, so I apologize for those of you. I've been pretty good at keeping it to 30 minutes, except for Bill Gaventa's presentation on loss. Anybody want to share? What do you think is some, and feel free to jump in on this. I mean, to me, I've learned a lot about how the unexpected, we so didn't expect this, and we were pretty unprepared for something like this. It really threw us for a loop. And I've seen people really give of themselves to work in those residences day in, day out. I've seen families struggle with unbelievable barriers and challenges. I've seen people with disabilities rise to the occasion. And so one of the things, you know, it reminds you of is the human spirit. And that aspect of it, to me, I'm very positive, despite the sort of terrible conditions that people have had to put up with, ranging from obviously seeing someone pass away to feeling like it's Groundhog Day every day with the same old, which is a mild annoyance, right, compared to what could have happened. I also think we've learned how quickly government can respond when it wants to. And I do think we've learned the importance of straight communication, you know, transparency. And I think it makes us wonder, with this virtual learning, we know it works for some people and it really doesn't work for a subgroup of people, right? It's just not going to work. It's almost requires someone to help them connect with the virtual learning. But I do think this virtual experience together is healthy when we're isolated. Anybody want to touch on that and other things you've learned, or love to have one or two people make some comments on the situation, what they've learned, or disagree with me, and then we can talk about looking ahead.
Yeah, probably, Leo, I would have people feel free to unmute themselves if they would like to share.
Hi, Leo. It's Deborah Stevens.
Hi, Deborah.
This is a somewhat unexpected thing, but we would go to meetings and explain what our daughter's behavior is like at home, and her behavior at her day program would be different. We hired somebody from her day program who can now back us up on behavior at home versus behavior at day program.
Right.
So we're getting kind of like, because we always would get people shaking their heads, you know, well, we don't see that here, or she doesn't do that here, or we can't get her to do that here. And now they're seeing what she can do and what she does do for us at home. And we're
Awesome.
going to be able to now have somebody witness it and testify to it. But we have, you know, we've had to be very clear that we, you know, my husband and I, we both work from home. So we do have some other benefits that way. And we decided, though, we had one person who was a PCA. We hired one person from her day program as a PCA. And that allowed, but, you know, us to cover time, because otherwise every day is a Saturday.
Right. Right.
The thing is that if either of those two people aren't there, we had to consciously decide we were going to have to cover, and we were not inviting a third person into the house.
So you felt, Deborah, you felt comfortable with the people you knew from a PPE perspective and a contamination
Yes.
perspective. So many families, I'm so happy for you guys that worked out, because so many families, because they don't have enough availability from the people they know, are doing it on their own, are roughing it.
Well, what it, you know, first of all, the other thing is whether or not our daughter would even accept somebody who was wearing a mask.
Right.
And when they go outside, I mean, in the house, we were not having masks on in the house originally. It's not full PPE. People are not coming in here fully, you know,
Right.
garbed,
Right.
but they come in, they're washing their hands. Thing is, no, I cannot get everything that I need. And the reason I can't get everything I need is because I'm going out there as a single person trying to get things where things are, you know, no longer in existence. It's, you know, hunter-gatherer mode as far as, you know, disinfecting wipes.
Well, you know, let me stop you there just in case somebody else wants to say something. But Deborah, I just want to point something out about what you said. It's true for not only families at home, individuals with disabilities at home with a wife or alone, but also for people that provide shared living or AFC. If agencies don't help them in those programs get help, they're going to be treated like you are, an individual walking in, just hunting yourself, hoping to find it. But that's, thank you for
But
your.
let me just mention this quickly, and then absolutely somebody else. The thing is that Mass Health, Carly gets incontinence supplies. I am allowed so many gloves for her. Obviously, I'm going through these things at a faster rate. That amount has not been upped. Getting hand sanitizer, I was going to buy it through the provider myself. I was told one moment they had it, that they don't. So the thing is, I think that there could be some help from Mass Health or however, for those of us who get those types of supplies, so that the company that I use to provide this, they have the buying power
Right.
to get it
Right,
to
but
us.
they were having trouble too. So just to be clear,
Exactly. Right.
that was the problem. You
No, I
almost
know.
walked out, but no, and I get it. And thank you, Deborah. Thank you. I've known you
Okay.
for, I don't know, 20 something years at least. So
Yes, definitely.
great to hear from you. Maybe 30 years. Yeah.
Not
So
20 so much. But the
I-
other thing is that there are some things that people can do if you have somebody else who is a guardian in your house and you're willing to have only one person act as guardian
right.
instead of two people, then maybe the person who resigns, but that's a family choice that has to be made.
Right. And that's
But
legally.
people should be talk to an attorney or somebody about what other options exist.
Thank you, Deborah. Thanks. Appreciate it. Anybody else want to add something on this? And what a great example.
I'd like to, this is Ann.
Ann, hi, Ann.
Hi, there's a great number of people that have learned to communicate by Zoom. It's a new method. A lot of self-advocates never knew it before, and now they do. So, and the ones that have learned it, a lot of them still have to use someone else's computer or phone, but they're managing to communicate by Zoom. So if they had a cell phone, an iPad or something like that, I think they would maybe do it more.
Great point. And that's in a crisis, and it's pretty, like, that's the thing we regret, right? That to get people those iPads, get people that equipment.
Right.
But what a great point. That's a real plus. That's
I have a
happening.
question for you, though. Regarding your statistics,
Yeah.
are people on the PDP and living independently being counted on that?
I'm assuming they're part of the network because they're in the resident, right? They'd be still in the overall residential network. The funding comes through residential line. I have to double check that. It was just my assumption. I didn't double check that. I just assumed it, Ann. Good question. And Kerry, that's something we should follow up on just to be sure, but I would think so.
And
Leo?
Yes.
As far as the face masks, I've told people over and over again to present them to individuals as, like, right now it's a fashion statement. It's another piece of clothing.
Right.
It's not a punishment to wear a mask.
Right. That's a hard one, right? If someone doesn't understand.
And there
yeah.
are different styles. There's the ones that tie behind the head instead of if the elastic behind the ears are irritating.
Yep. And thank you. Anybody else? One last one. And then I'm going to we'll continue this dialogue, I think, next week, because I think it's rich with, I really like the idea of us looking to the future, but I don't think we're going to do that today. Anybody else want to jump in? And there's so many people I want to give a shout out to that I recognize today. Go ahead.
Lucy.
Hi, Lucy.
I guess one thing that somehow day habs and programs for people with intellectual disabilities don't get the same treatment as nursing homes. They're not considered part of what the state is responsible for. So we never hear anything on media about them. So I think that would be something to push with probably EOHHS, or that, they are a huge network and many people are being served, and they should somehow provide information and statistics like they do for nursing homes.
Yeah, and we're getting them, as you know, sort of, and I've been told, Lucy, the reason we've gotten the statistics, the reason they're slower, and it's because it's not the same sort of verification process they can do at bigger settings. So A, at the hospitals, B, at the nursing homes and rehab centers. So, and I appreciate that. There's over 2,000 homes and settings in our system. So that's the line. But I do think we could be covered more. And I do think the press tries, just to be clear. It's just I think people in our field also are nervous because of some of the early coverage. But I know we've been encouraging people to talk to different outlets in the Globe and WBR, BUR TV stations. And I think Channel 5, Channel 4, friend Chris McKinnon, others that on the other stations that are friends, you know, Channel 25, they've all pretty much done something on it. But it of course, in nursing homes was a huge crisis. The number of deaths that roared through the nursing homes was devastating. And I think that also had something to do with it. But you know where I agree with you too is on the command center site, there's actually, you can apply for a job at the congregate care settings, because I think there's so many National Guardsmen right now in like the soldiers home, places like that. So that is something they could have a link, right? For us. So it's something to think about for, because
I mean, it's a network, and it really doesn't seem to be available in an organized way.
Yeah, no, and I think that's the strength of it. It's also the weakness, right? Because at a time like this, we need a spotlight, and that's why I can't thank Josh enough and DDS and HHS for sharing the facts and statistics with Rep Cutler, and for us, then we turn it around. We look, it's not a upfront thing. I wait for his Facebook page, or our team members wait for his Facebook page, and then we go ahead and repost it. So you do at least get a piece of it. And again, they're fearful that it's not 100% accurate, the state folks. So that's why it's a little trickier. All right. So I feel like, you know, it's 12:43. It's almost 12:45. I try to keep this so I'm not overbearing with your time. We'll have another conversation next week, even with my guest. Like I said, I'm going to have a guest to talk about what it's like working in the community residence. I hope to have that person Monday. And then I think it's probably would be a good idea to get one of our families to, you know, the following week to have self-advocate and family talk about what's been, though. I know you guys get to hear from Maura and Ellen every week. So I want to remind people about that. I want to remind people about supporting the ARC. We really appreciate, I'll tell you, people have been really generous this year. I want to thank you all on the call and people, the volunteers, as well as those that donate. And just it's been a huge impact for us this year, or we would have had a real problem. And then I want to remind people on the weekly updates that are coming up tomorrow with Kerry, who's on, and then we'll ask Kerry who's on with her in a minute, or if she's doing it alone. Thursday is the update with Maura at 11. And then the federal update with Ellen Taverna is Fridays at noon. By the way, you may not know this, but Ellen will be taking maternity leave soon. I don't know exactly when. I don't know if I just spoiled that or if I'm allowed to say that, but we'll be missing her for a while. She'll be on leave, but not yet. But I don't know exactly when. I haven't seen her in a while. I'm missing out on the transition there. I told her the other day. We all are, right, Kerry? And
yeah, well, yeah, we're having our baby shower though on Thursday. So
that's right. We're having a virtual baby shower, but it's frustrating because you know, we can't see her evolve. But Kerry, what are you doing tomorrow?
So tomorrow I have directors from 3 family support centers coming to share what they're doing to support families, and the Berkshire County ARC, Sonia, people from the ARC of Bristol County, Dolores, their outreach worker, and Kelly Trickett from Lifelinks and class. So everybody's doing something a little bit different, but they're pretty much, you know, want to show what they can do. So there's no wrong questions for your family support centers.
And I want to close with this, and then we're gonna end the meeting. I just want to say, first of all, all of you, I recognize so many of you. You are the ARC. Thank you so much for all the different ways you participate, volunteer, and support. And I also want to give a special shout out to my board of directors, because during this crisis, the executive committee has been awesome, and we've worked through a variety of things. I want to also say to the staff, thank you for hanging in there. Some of you have kids at home. Everyone's been trying to do what they can and have done what they can, and it's made a difference for our work. So volunteers, staff, family, just God bless you all and have a great day. And hopefully you'll see Carrie tomorrow on her check-in. Take care.